Welcome to the Megacast. I'm Tyler Keefton, studios of our flagship station, Civic Center TV and 89.3 Lakes FM. In addition, today, as always, you can find us also on Comcast Channel 15 and AT&T Channel 99 on Birmingham Area Municipal Access in the Birmingham-Bloomfield area, as well as on City Cable 15 of Southfield. Join us on Channel 10 in Waterford on the Media Network of Waterford, as well as in Orion Township and Lake Orion on Orion Neighborhood Television. We're also on the radio in the Birmingham, Bloomfield, and Troy areas on the Biff Radio Network, a service of the Bloomfield Hills School District, most notably on 88.1 WBFH. Find us online on Facebook at Civic Center TV 15 and on Facebook at Lakes FM. On our website, civiccentertv.com, by clicking on our Watch Live link either at the top of the homepage on your computer web browser and some tablet browsers, and then on most mobile devices on our mobile website. It'll be in a drop-down menu on the left side of the screen. You can also find us online on My Michigan TV, otherwise known as MyMy. Visit mymytv.com to learn more information, to find us live, to find some of our interviews and full episodes also on demand over there on MyMy, and to learn more information about where you can download their free smart TV and smartphone apps so you can watch us on the go and watch us from home on your TV as well. You can learn more information about everywhere that we broadcast live and live to tape and find all of our shows on demand by visiting civiccentertv.com and clicking on our Megacast link. Also on our website at civiccentertv.com is our coronavirus page, where we have helpful information from the CDC, the MDHHS, and the Oakland County Health Division about COVID-19 as we continue to learn more about the novel coronavirus, learn more about the spread of this virus, learn more about the variants such as Omicron that's currently spreading quite rapidly, continuing to spread quite rapidly, as well as the Delta variant that's also continuing to spread here in Michigan, and other variants that will ultimately pop up in the future as we continue through this pandemic. Also learn more about ways that we can maybe stop this pandemic, such as vaccination and booster shots and precautionary measures like mask wearing and distancing that will limit the spread of COVID-19. From these resources federally at the Centers for Disease Control and Prevention, statewide at the Michigan Department of Health and Human Services, and locally here in Oakland County, where we originate our broadcast from the Oakland County Health Division. On that page as well, we have articles we link to articles from journalistic outlets all across the state of Michigan to keep you up to date on the latest with COVID-19 and other top stories making news in the Great Lakes state. Today, our top story, an update on coronavirus cases from the Detroit News, as Michigan added 86,009 cases as well as 501 deaths from COVID-19 over the past 5 days. That, of course, includes cases from Saturday, Sunday, Monday, and Tuesday due to the holiday this week, where cases were not reported on Monday because of Dr. Martin Luther King Jr. Day, which is a federal and state holiday. The state averaged 17,202 confirmed cases per day over those 5 days. Of the latest deaths reported, 346 were identified during a delayed records review, according to the state health department. The MDHHS on Wednesday recorded 4,453 adults and 114 pediatric patients being hospitalized with confirmed infections in the state. About 83% of the state's inpatient beds are also occupied at this time. Adult hospitalizations are nearing records set on January 10th, where inpatient tally of 4,580 adults broke a previous record set on December 13th, when the state health department reported 4,518 adults were hospitalized with confirmed COVID-19 infections. Earlier this month, the state set a new high mark when it reported more than 20,000 cases per day. Michigan's top health officials have described the state's COVID-19 situation as being quote-unquote critical and urged vaccinations and booster shots and masking as a fourth surge of the virus has driven up hospitalizations. About 25% of hospital beds were filled with COVID patients as of Wednesday, and there were an average of 2,457 emergency room visits reported to COVID-19 per day in the state. During a press update on Wednesday, Henry Ford Health Systems officials said they are hopeful that, quote, a slight decrease of COVID-19 hospitalizations this week and with a slight decrease in staff vacancies as well. Based on recent data from the Michigan health system, the state health department found that in 2021, 88% of COVID patients hospitalized were unvaccinated, and 85% of COVID-related deaths were occurring in unvaccinated individuals. Hospital systems are warning of a quote-unquote breaking point amid the surge, and federal medical teams are assisting at Beaumont's Dearborn location, Henry Ford's location in Wyandotte, Spectrum Health in Grand Rapids, Covenant Healthcare in Saginaw, and Mercy Health System in Muskegon. The current surge in COVID cases and hospitalizations could send a quote, already stressed and closed, quote, healthcare system, quote, unquote, over the edge, said Michigan's top health officials last week. Quote, this surge is not like the others, end closed quote, said Dr. Natasha Bogdasarian, the state's chief medical executive, to reporters last week. Continuing on, quote, this is the highest number of weekly cases we've ever had, and closed quote. That full article from my friends at the Detroit News on our website at civiccentertv.com/coronavirus. Also making news on the economic front from Bridge, Michigan. Studies are showing that Michigan's economy is still struggling to compete with other states. Michigan remains in the bottom half of states when it comes to economic growth, despite 12 years of gains since the Great Recession, according to a study released on Thursday by a nonprofit statewide business advocacy group. The next 5 years will be pivotal for the state as it tries to improve and attract jobs, raise education levels, and increase personal income, says the top executive of Business Leaders for Michigan, which is linked in this article. Quote, we've got a lot of headwinds facing us, end closed quote, said CEO Jeff Donofrio to Bridge, Michigan. Among the disruptions, he said, is the automotive industry's accelerated shift to electric vehicles, which will affect at least 160,000 workers here in Michigan. Among them are 46,000 workers who work directly on the internal combustion engines, whose production manufacturers expect to cut by half by 2030. Labor force participation is also a challenge. Michigan had 191,000 fewer people in the workforce of its 4.758 million in November of 2021 compared to 2 years before that, according to the Bureau of Labor Statistics. About 59.5% of adults in the state hold a job or are looking for one, compared to 61.9% nationwide. The annual benchmarking report by BLM put Michigan at 29th among the 50 states for economic growth, a ranking that Donofrio called, quote, middle of the pack, end closed quote, after comparing it to its initial position of 49 in 2010. The goal remains to get Michigan into the top 10 in those rankings. Ranking from highest to lowest, Michigan's scores in the data comparison with other states in 2022 show that business climate perception, we are 15th, net talent migration 19th out of 50, net business creation 20th, poverty 34th out of 50, median household income 35th, as well as educational attainment being 35th, GDP per capita is 36th, and labor force participation 41st out of the 50 states. More information on this study and more comparisons of Michigan's economic growth and economic stability to those of other states in context with the pandemic from our friends at Bridge, Michigan, linked in that article, which we have linked on our website at civiccentertv.com/coronavirus. Lastly, making headlines today as Oxford High School students prepare to return to class very soon. Oxford High School's memorial will be removed ahead of that return. This is from the Detroit Free Press. A memorial created for the victims of the Oxford High School shooting on the school grounds will be removed before the first day students return to campus next week, Monday. Oxford Community Schools Superintendent Tim Throne said the memorial will be removed to further students' quote-unquote healing process in a Wednesday announcement. Quote, the temporary memorial has been created by our community played a beautiful role in honoring and remembering our lost Wildcats, and provided a place for our community to grieve, Throne said, continuing, quote, as our high school welcomes students back to the building on Monday. Trauma specialist Dr. Henry, along with those from other schools that have gone through similar situations, have advised us that the temporary memorial should not be there when our students return to campus, and closed quote. Families of the victims will be able to take home any items from the memorial, and anything not kept by the families will be stored for potential future use. Throne said that the memorial has also been professionally 3D scanned as well. Quote, "We will soon begin to plan for a permanent memorial to honor the beautiful lives that we have lost," he said, continuing on. "This will be a long and well thought out process. It will first begin with consulting the families of the victims and discussing their wishes. Then a committee of students, staff, and parents will be created to begin this planning," end close quote. The memorial will be removed on Sunday, so anybody that would like to visit one last time is encouraged to do so through Saturday of this week. That full article with more details from the Detroit Free Press on our website at civiccentertv.com/coronavirus. In addition to that, as always, we have links to other articles from more recent editions of the Megacast as well, so you can continue to keep up to date on everything on the COVID-19 front and beyond, making headlines across this great state of ours, and, of course, find those very helpful links to the MDHHS, the Oakland County Health Division, and the CDC's resources on COVID-19. Those take you directly to their COVID-19 web pages, so that you don't have to navigate around their websites and all these other places to find that information. It's a good place to start if you want to be gathering more information on the spread of COVID-19, on the ways COVID-19 spreads, on precautionary measures, vaccines, booster shots, whatever you may want to learn about. They have a lot of statistics, a lot of studies, a lot of Q&As and FAQs on there as well that you can read through to gain as much information as you need from experts on the front lines of this pandemic. Again, all of that, and as well as our top headlines today and every day at civiccentertv.com/coronavirus. We have a great show ahead of you today. Coming up in just a few minutes at 10:20, we'll speak with Leo Nouhan, who is the board member and conference coordinator of Kevin Song's 6th annual conference on suicide. He will join us at 10:20. At 10:40, we will be joined by Roz Keith from Stand With Trans at 11 o'clock. Dr. Manu Malhotra will join us, the Chief Medical Officer at Henry Ford West Bloomfield Hospital, to continue to talk about the impact of COVID-19 on our hospital systems. At 11:20, John Saub, the creator of the Man in the City art project, will join us on the show to talk about the project as well as some of his work with the youth in our local area and across the country as well. And then at 11:40, David Franco, the director of the Exceptional Academy, which is part of the Living and Learning Enrichment Center, who we, of course, spoke to earlier on this week, and is also a Share Detroit charity, will join us to cap off the show at 11:40. That's all coming up next. You're watching and listening to the Megacast.
Who is struggling right now?
I am.
My son is.
Many are struggling with anxiety, depression, and substance use. Before it becomes a crisis, reach out to MyCal, the Michigan Crisis and Access Line, for free confidential support 24/7. Available in the Upper Peninsula and Oakland County. Just call or text 1-844-44-MyCal or chat online at michigan.gov/MyCal. A message from the Michigan Department of Health and Human Services.
Motorcyclists are hard to see. To keep everyone safer, it's important to always look for them and know where most crashes occur. 84% of motorcycle and vehicle crashes happen on streets, not highways. And most crashes with motorcyclists occur when vehicle drivers are turning left. So before turning, especially to the left, make sure you look for motorcyclists. Then look again. It could save a life.
To Sophia and Gabriel. Even though these old knees can't follow on your adventure to the forest today, these flowers represent my love. These stitches and threads join us together. And wherever you see a flower, a bird, a beautiful tree, know that my love is with you.
Make the forest part of your story at a park near you. Find one at discovertheforest.org.
72.7% of high school students get less than the recommended 7 to 9 hours of sleep a night. This can cause pain, obesity, and can very negatively affect your mental health. When you have a consistent 7 to 9 hours of sleep every day, you get sick less often, lose more weight, and have better relationships with those around you. For more information about the dangers of sleep deprivation, go to sleepfoundation.org. This message is brought to you by the WBHS Digital Media Arts Program and 89.3 Lakes FM.
Can I ask you a question? Why did you get your kids vaccinated?
It was hard for them to social distance, to be isolated from their friends.
want them to get back to school and sports games. So as a pediatrician, I recommend the vaccine to everyone I know.
The boys lost a former teammate and classmate who was only 20 years old. It's been a devastating year.
We want to get back to normalcy. Our daughter is really looking forward to being with her friends, being a kid.
It's the Great Lakes water, and so what people do ends up in our waterways.
Flushable wipes are just evil. They should be thrown away. They're impossible to destroy, and they can cause significant problems.
One of the main things when you're cooking is to not dump fats, oils, and greases down your drains.
They stick to the sides of pipes, they stick to everything they come in contact with. Don't put it down the sink.
There's one water, and it's ours to protect.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. Call 211 or visit 211.org. 211. Get connected, get help.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Neighborhood storm drains carry water directly to local creeks and streams. No filters, no treatment.
Storm drains also help reduce street flooding when it rains.
So clearing storm drains and the areas nearby of trash and leaves helps keep them for rain only.
It is easy to do your part by adopting a storm drain.
Find a storm drain, check it, and clear it every month.
So keep storm drains for rain only.
There's one water, and it's ours to protect.
If you are struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to a $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit or call toll-free at 833-511-0311.
A public service announcement from 89.3 Lakes FM. Welcome back to the Megacast. I'm Tyler Keefe. You can learn more information about everywhere that we broadcast live and live to tape, and find all of our full shows and individual interviews on demand at civiccentertv.com by clicking on our Megacast link, or just going straight to civiccentertv.com/Megacast. Joining us now is Leo Nouhan. He's a board member and the conference coordinator of Kevin Song's 6th annual conference on suicide, joining us on the Megacast. Leo, thank you for being with us today.
Thank you. Happy to be here.
Appreciate having you on. So, of course, Kevin's Song is your organization, having your 6th annual conference coming up soon, your 6th annual conference on suicide. Let's start off by talking about Kevin's Song, about the organization and the origins for it, and about the person that was the inspiration behind the organization, Kevin Urso, as well.
Sure. Kevin Urso was the son of John and Gail Urso, and Kevin took his life in 2013. The following year, John and Gail decided that in honor of their son, they wanted to form an organization that could focus on suicide prevention. They didn't realize how serious suicide was in terms of being one of the leading causes of death for young people and working-aged men and so on. And so they created Kevin Song. And over the last 7 years, Kevin Song has grown to be one of the premier suicide prevention organizations, nonprofits in the state of Michigan. We have prided ourselves in networking with other coalitions and other nonprofits throughout the state, as well as with the state of Michigan, to combat suicide and to work together to engage in meaningful prevention efforts.
And so
through our conference. Yeah.
And so your upcoming conference, it's the 6th annual conference. It'll be coming up very soon here. It's on January 27th through the 29th, which will be next week. It is the largest conference on suicide to expand conversation and provide solutions on systemic inequality in suicide prevention. So what will be some of the topics that will be discussed there? Obviously, there's a lot that goes into discussions on suicide preventions and action on suicide prevention to help our communities prevent these kinds of tragedies from happening all across the board. So what will be some of the topics of conversation and some of the seminars that people may be able to attend and learn from at this conference?
Well, the conference is a virtual conference, so it's an online conference that's live. And we have keynote speakers and breakout sessions over 2 days. And then on Saturday, we have a live streamed Facebook presentation where we'll have a series of people kind of sharing their own experience with suicide loss and surviving suicide, and a panel of individuals that will share their stories. So the gist of it is, Tyler, that we are focusing on equality and equity and suicide prevention. Most recently, in December of last year, the Surgeon General came out with a report, and basically, while in general the suicide rate has not dramatically increased throughout the term of the pandemic, it has increased in certain communities. And it seems like certain communities that were already disadvantaged, whether by racial situations, economic situations, cultural situations, those communities that were already disadvantaged suffered additional increases in suicide through the course of the pandemic. So we wanted to focus on those communities. So we have, for example, Ellen Kahn from the Human Rights Campaign. She's going to address the impact of suicide on gay and lesbian LGBT youth. It's a serious issue because those students, those young people that struggle with issues of sexual identity and sexual orientation often find themselves in a mental health crisis. And it's important that clinicians and teachers and parents understand what is going on with those youth and how they can intervene to prevent self-harm. We also are focusing on the effect of suicide in the African American community. We've got a couple of excellent speakers from the crisis text line that are going to focus on how the African American community grapples with suicide, because it's a little different than other communities deal with those issues. We have some great discussions on Friday about the whole impact of suicide and depression and mental health problems among working-aged men and veterans, because they are probably the most seriously hit groups for suicide. And so that's just a sampling, along with the survivor stories on Saturday. We like to appeal to a broad cross-section. The Thursday program appeals to people that deal with youth, so educators, clinicians. On Friday, we have a more general program, and our keynote speaker on Friday, Craig Bryant, is a well-known suicidologist and has just written a book about rethinking suicide prevention, because for so long we focused on suicide as the result of mental illness, and Craig is challenging us to look at other reasons that might be responsible for an increase in suicide.
And we're joined by Leo Nouhan from Kevin's Song, an organization that will be holding their sixth annual conference on suicide prevention coming up in late January. That's January 27th through January 29th. It is a virtual conference as well. And so, Leo, you're an attorney. How has your work ultimately brought you to be working with Kevin's Song and joining this organization and helping to not only inform the public about some of the risk factors for suicide and some of the prevention measures that can be taken across the board to prevent these tragedies, but also to work to help this organization prevent these further tragedies in the future.
Well, I happen to be a friend of John and Gail Urso, so early on after Kevin took his life and they formed Kevin Song, John and Gail approached me to see whether or not I would be interested in helping them organize and manage a conference. And so I am basically a healthcare attorney. I worked in-house for Blue Cross and Blue Shield for many years and have kind of focused my practice on issues involving health and mental health, and have represented a number of individuals that have been denied mental health services or whose services were abruptly terminated because of certain conditions in insurance plans. And so access to mental health care is a very personal issue with me because I've dealt with it professionally, and I know the effects of the inability to access quality and professional mental health services. So that's really what drives me to work with Kevin Song and to try to change attitudes culturally about the need for mental health services and to try to erase the stigma that attaches not only to mental health problems, but also to suicide in particular.
And you mentioned earlier that some of the discussions that will be had in the seminars and the breakout sessions, in the general sessions as well at the 6th annual conference from Kevin Song will be about the disparities in prevention advocacy in communities, as well as in prevention tactics across the board as well. For those that may not be familiar or may not be aware of some of those disparities or some of those some of the areas where our prevention tactics and our prevention advocacy across the board is lacking, what are some of those common mistakes that are being made or those common errors that are out there that Kevin Song is trying to bring awareness to so that we can make proper corrections and provide the mental health care and provide the advocacy and provide the support to those that may be suffering from suicidal tendencies or from mental health issues to prevent suicides across the board, especially in those communities where they're being more affected and they're not necessarily getting the same amount of care as certain other communities are on this front?
Well, I think what it really boils down to is that in the past, I think that suicide prevention efforts that are evidence-based have been used pretty consistently across all demographic areas with varying degrees of success. And I think that the recent kind of understanding culturally and from society standpoint that we have come to in being aware of the differences among us, that we all have different triggers. There are different cultural environments and situations that contribute to our individual grappling with mental health issues. And so what we're trying to communicate and educate the suicide prevention community is that you may not be able to just apply the same rules and practices across the board to every affected community, that you need to model those efforts to take into consideration the individual needs that vary from community to community. And so to understand better what LGBT youth are struggling with, what are some of the issues that they're addressing, might affect the way that you approach those youth with trying to intervene when there's a crisis. The same thing with, let's say, the African American community. What are the unique qualities of that community that will help you better reach out to people that are in crisis? And that's really what it's all about. It's all about intervention and preventing that crisis from developing into something deadly. And if we can understand the person and understand where they're coming from and what their makeup is, then we can tailor our prevention efforts to really help people where they're at. And that's really the important focus of our conference. Whether it's an LGBT youth, whether it's an African American, a Hispanic, whether it is a veteran, a working age white male, each of those demographics has unique characters and unique qualities that may influence how you approach them when it comes to prevention and risk assessment.
And then, Leo, just another couple minutes with you. If people want to participate in the conference, in the 6th annual conference on January 27th through 29th virtually, or they want to help the organization in any other way, whether it be volunteerism, whether it be financially, whatever way that they can help, where can they get more information if they want to participate?
Well, our website is the best place to go. We have a Facebook page, I believe an Instagram page as well, but our website is kevinsong.org, and you can register for the conference there. There are also scholarships available if somebody would love to attend the conference, but the cost, even though it's pretty reasonable, if the cost is prohibitive in any way, we have resources available to accommodate those folks. So if anyone in your audience would like to attend that conference and they have, they can go to our website and register. They can watch the survivors tell their stories and share their experiences with Hope and Healing on Saturday. They can watch that live on Facebook. So we welcome anybody that would like to register, whether it's via a paid registration or a complimentary registration for those who can't afford it.
To learn more information, you can go to kevinsong.org/conference, and you can also visit their website for links to their Facebook page as well.
Absolutely.
Leo, thank you for joining us.
Thank you.
Appreciate it. We've been joined by Leo Nouhan, a board member and the conference coordinator at Kevinsong as they are approaching their 6th annual conference on suicide. It will be a virtual conference January 27th through January 29th. And again, you can learn more information by going to kevinsong.org and either clicking on their links on their front page or at the top of their page for their annual conference, or just going to kevinsong.org/conference. We're going to take a break. On the other side, we'll continue to talk about medical issues and medical advocacy issues, including mental health in at-risk communities, particularly the LGBTQIA+ community and the trans community, with Roz Keith, the founder of Stand With Trans. She's coming up next. You're watching and listening to the Megacast.
We as Michiganders feel connected to this resource in a way that I think is really powerful.
Conservation starts with a caring, committed community.
For me, it's peaceful to have a relationship with the river.
Every single one of us has a role to make sure that those waterways stay safe and healthy, being careful about what goes down the storm drain.
Just even eliminating some of your single-use plastic makes a difference.
There's one water, and it's ours to protect.
Did you know that nearly 3.31 million Americans don't get their annual checkup? Going to the doctor regularly is extremely important and is a crucial factor in maintaining good health. Make sure you are visiting your local doctor often and telling them about any health concerns you have. For more information, contact your local healthcare provider. This message is brought to you by WBHS Digital Media Arts Program and 89.3 Lakes FM.
People are getting out to walk and bike in higher numbers. More vulnerable road users and higher speed traffic can be a dangerous combination. Crash severity has increased, so if you're driving, be sure to slow down and look for people. There's no need to speed. If you're biking, ride with traffic. If you're walking, avoid stepping into the road if possible. If you have to walk in the street, walk facing traffic. Learn more at walkbikedrivesafe.org.
Joining us now once again is Roz Keith, the Executive Director of Stand With Trans, back with us once again on the Megacast. Roz, thank you for being with us.
Thank you for having me. This is, I guess it's starting to be a regular thing, so I'm really excited.
Yeah, glad to have you.
Nice to see you.
Yeah, good to see you as well. Happy New Year to you and everyone involved with your organization. For those that aren't familiar, for those that didn't join us the last time we had you on, or hearing about your organization for the first time, can you tell us a little bit about Stand With Trans and give us a bit of an origin story for your organization?
Sure. So Stand With Trans began in 2015 with really just an idea. Our mission is to support transgender and non-binary youth so they feel supported, empowered, really giving them the tools and the life skills so they can live their authentic life. And along with that comes educating the families, educating community, really teaching people what it means to be transgender. We know that this kind of support and education, if you will, and access to resources is life-changing and life-saving for so many. We started the organization because in 2013, almost 9 years to the day, my younger child, who's now 22, but my younger child at the time came to me and said that he was transgender. And if you are at all aware of what's been talked about in the media of late in the last couple of years, you're probably somewhat aware of what's going on with there's a lot of discrimination, a lot of transphobia, a lot of bills discriminating against youth in schools and trans people in general. But 9 years ago, none of these conversations were happening. And in fact, you could use whatever bathroom you wanted and no one even blinked an eye. So I didn't know anything. I didn't know the word transgender. I was really not surprised, I guess, by my son's declaration, but I had no idea how to help him, what it meant, what the long-term outcomes would be. So I had a lot of research to do, and I just started Googling. Unfortunately, there wasn't a lot that came up, and there really were no resources, at least in the Metro Detroit community, and I wasn't even finding anything nationally. We couldn't find trained mental health support. We couldn't find the right medical support. In fact, there was one pediatric endocrinologist, which is the type of doctor who prescribes hormones to people who want to medically transition. There was one in the area, and she didn't take our insurance. There were no support groups. There weren't any books I could find at that moment. So it was really heartbreaking. I couldn't find what I needed to help my child. That was the most difficult part of the entire early process, was not having access to support and resources that would make a difference. So, about a year and a half or so in, we were working things out and cobbling together a plan for our son. And we realized, as we started to tell our story and tell our story publicly, that there were hundreds and thousands of families out there just like ours. And we really had no idea, because we were isolated and we felt so alone. But seeing that outpouring, and families who were just hungry to support their child, love them unconditionally, and were just looking for some lifeline, that's where the idea of Stand With Trans came from. And ultimately we filed for our 501c3. I have to say, I didn't really know what I was doing at the time. Maybe I shouldn't admit that, but we just wanted to help. We just, I knew what our support meant to our child, and we wanted to be able to offer that to other families who were struggling. So here we are, nearly 7 years later, organizationally.
Yeah, 7 years of Stand With Trans, founded in 2015, and then, of course, your journey about 9 years ago, beginning with your son coming out, and so back then you said that there were very few resources, if any, that you could find to help your son, to provide the assistance that he needed, that your family needed as he was transitioning, and so. now 7 years later with your organization, a lot of these resources are being provided by your organization, and that's arguably the most important impact to have, is because for groups that are marginalized, for groups that are being discriminated against, that are either having resources pulled away from them or simply not provided to them at all, having resources that they can get more information, that they can get the supports they need, becomes so critical. So for families with trans kids, or for trans individuals themselves that are looking for these resources, what are some of the resources that are provided to them through your organization?
Sure. So we have, kind of going back to our beginnings, the very first program or ongoing program that we developed was a support group network. And we now have virtually a number of groups throughout the month. Up until 2020, we had groups in person all over the place. We had about 12.5 groups that parents and young people could access. Right now it's all virtual. So they're for tweens, ages 9 to 12, teens, 13 to roughly 19, and then non-binary young adults, 18 to 24, and parents and caregivers. And those happen throughout the month. They're all on the standwithtrans.org website. They're facilitated by those who have been trained. So parent groups are facilitated by parents. In fact, I facilitate one that's happening tonight. So if anyone needs support, it's at 7 p.m. Eastern. And that really, it's so important. And, now one of our biggest challenges, of course, is that our virtual world is continuing, that we aren't yet able to start adding back in-person indoor support groups. We were on the verge of that about a month ago, but we're, given what's happening with COVID, we put a pause on that. So, it makes it challenging for youth who are just who want to connect and who want that community, and they don't necessarily want a support group. They just want to hang, and they want to meet other kids like them. So that's something that for 2022, we're really going to be working hard on, is how can we bring that engagement and the fun and the community building back to the community and back to the youth, so we can give them some of what they need while still being safe and being virtual.
We're joined by Roz Keith, the Executive Director and founder of Stand With Trans, joining us on the Megacast. You can learn more information about the organization by visiting standwithtrans.org. And so, Roz, you mentioned that a lot of these programs, these support groups in particular, are virtual due to the COVID-19 pandemic. But on a broader sense, on the COVID-19 front, I would imagine, given the struggles that are often had by LGBTQIA plus individuals, by trans individuals, certainly on the medical front in normal times, that those have been amplified and those have been even greater during the COVID-19 pandemic, whether it be for simple checkups or for COVID-19 related treatment. How has the implications of the pandemic changed the way that you approach providing these resources, or at least, or better yet, let me say the necessity of these resources being provided to trans youth, to trans teens, to families of trans individuals, because of the crisis that we continue to be dealing with, as well as the crisis that the trans community has been dealing with, unfortunately, for so long in the medical community?
Yeah, wow. Well, that's a big question. Yeah, so one of the things that we're seeing across the board is the isolation due to being sequestered at home, which is still going on. Even though many kids are back at school, there's still a lot of virtual everything going on. And it has increased significantly the need for mental health support. Often kids aren't out to their families, and if they have to be at home, if they're going to school virtually, that means they're at home with unsupportive family members practically 24/7. And that is just exhausting and wears on the psyche, and is not does not create any positivity in the moment for trans youth. So the need for the mental health support has grown. The good news, it's sort of a good news, bad news. The good news is we have more trained clinicians than we had several years ago, but there still aren't enough. And they're working long hours to be available, but many are not taking new clients. Many have waiting lists. So it's really tricky. And then you've got the whole social distancing and pandemic piece of it, where most of the therapy now is televisits. And telehealth is a beautiful thing, but not everyone feels comfortable talking to a therapist like this, on the screen. It's really not as personal, and it's just, so it brings a lot of challenges. One of the things that we're trying to do right now to help support that is we have a program that actually is funded by the United Way of Washtenaw County to bring to pay for some therapy sessions for youth who live in Washtenaw County. The therapists can be anywhere in Michigan, so we're working to secure. We've already got 3 on our list, and we're recruiting for youth to apply. So we will pay either a copay if there's insurance and they can't afford the copay, or a session fee if there's no insurance, and the youth will receive up to about 8 sessions. So it's short term, it's not a long-term fix, but it will provide access to those who just, can't find somebody. Their situation, their financial situation has changed. They can't afford to pay for multiple sessions. So we're hoping to get more of those support systems to the youth who really need it. And, yes, it's limited. There's only a small bucket of money and it's in one county, but hopefully, these programs will grow. And then while that's happening, more therapists will get trained, more therapists are graduating and becoming licensed. So it's just, it's a slow process.
We're joined by Roz Keith, Executive Director of Stand With Trans, joining us on the Megacast. You can learn more information about the organization as well as its programs and resources by visiting their website at standwithtrans.org. And Roz, you offer many parent support groups as well for parents of those with trans children or teens. How does the journey differ for parents as opposed to their children? I would imagine in this process, because I would imagine for some parents like yourself who are very supportive of their child's gender identity and are working with them as they make the transition, as they begin to identify with their true identity. But in some cases that may not always be the common case with parents. So what resources are provided to help parents not only learn more about their child's gender identity, but also to help with the transition in general, to make sure that it is comfortable and is smooth, the entire process of coming out for the child?
Yeah, great question. So there are most everyone, every parent who finds out that their child is transgender has some feelings wrapped up in that announcement. Maybe they saw it coming. Maybe they, already knew. Maybe it was a total shock. We're going to, lay money on the fact that every one of these parents loves their children, would go to the ends of the earth for them. But there seems to be this shift. They find out the news, not everyone, but there are a lot of parents who find out the news and they just they're unable to kind of see beyond their own feelings about it to help their child. And I'm not saying this happens all the time, but we do see a lot of this. In fact, this question just came up recently from a group of therapists, and how to help parents who say, I don't know how to deal with the loss. I'm grieving. I feel like I'm mourning my child. I don't have a daughter anymore. So there's a lot of very complicated emotions wrapped up in the process. And one of the pieces of advice that we like to share is you own your emotions. Those are your feelings. And you have to separate them from the way you feel about your child. And if you come to a support group or you go to therapy or you talk to your spouse, you read up on the subject, whatever works for you to manage those feelings, take that path. But on a parallel path, you have to demonstrate that support to your child. You have to be positive. You have to allow them to take the lead and help them get to that next step. Because if you share those feelings with your child, they feel bad, they feel guilty, they feel like, maybe I shouldn't transition because this is making my mom sad, or this is, creating a lot of angry feelings. So, kids take that all on, and it is not okay for us as parents to put those emotions and those feelings onto our children. So it's very tricky to walk that parallel line, that parallel path, because the feelings for a parent who are struggling, a parent who is struggling, are so powerful. But there's a video out there, and I'm going to botch it terribly, but it talks about, you're taking a trip and you've packed for Italy. You've planned this trip for months and months and months. You cannot wait to get there and to tour and to see the Leaning Tower of Pisa and go to the Italian Riviera and drink Italian wine. And, you're about to land, and the pilot comes on the plane and says, welcome to the Netherlands. And you're like, wait a minute, the Netherlands? I thought I was going to Italy. And so having a child who comes out as trans, or having a child that has any differences whatsoever. So there could be a learning deficit. Maybe they have Down syndrome. It could be any number of things, but it's not what you expected. It's not what you expected when you were anticipating the birth of your child. It's not what you expected when you held this baby in your arms, or even, watched your toddler begin to run. And so a lot of it is helping parents to manage the change in what will be. We all have dreams about things, or we anticipate what the future will look like. And it doesn't always come out the way we planned. So, for parents, I just encourage them to talk to someone, come to a group. There are so many books now. I found one really great book 9 years ago, but there are so many. We have this huge book list on the Stand With Trans website, which is an incredible resource. We do book reviews every month that goes out to everyone on our mailing list. And many of them are from parents who have walked this walk and come out the other side. And that can be really helpful. So I'm not saying, don't honor your emotions and don't let yourself feel things, but put things into context, keep them in your lane, and then allow your child to progress on the path that is needed for them.
Wow, thank you so much for joining us. Appreciate your time.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. call 211 or visit 211.org. 211. Get connected, get help.
Parents do a lot of worrying. Get your kids caught up on childhood vaccines to protect them from these 14 preventable diseases, and you'll have 14 fewer things to worry about. Vaccines are safe and effective and save lives. So let's get caught up on vaccines and worry about something else. Get the facts at ivaccinate.org.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Most of the pollution that goes into our rivers is carried by rainwater that flows off of roads, parking lots, and rooftops.
The leaves and bark of a single tree can retain a surprising amount of rainwater. Depending on its size and species, it could be 100 gallons or more.
It is estimated that an urban forest can reduce annual runoff by up to 7%.
Here's one thing that we know can help keep our water clean.
Plant a tree.
Plant a tree.
Plant a tree.
There's one water, and it's ours to protect.
One of the things you can look for in your friends is a change in behavior.
These can be big changes, they can be small changes in mood, physical appearance.
They may be sleeping less or sleeping more, drinking more, or their eating patterns may be different.
One big change that can be pretty obvious is change in motivation. Do they no longer want to play basketball? Do they no longer want to play video games?
Now that we're spending more time online and in virtual settings, it's really important to pay attention to the language that your friend is using and the words they're using to communicate.
So when we text our friends, are they taking longer amounts of time to respond? Are they not responding at all? You don't have to be an expert to try to recognize these signs. The second that you feel it in your gut and that you're concerned, that's the second to have the conversation and open the door to what might be going on.
Whatever gets you talking. Today, it is easier than ever to join Michigan's Organ Donor Registry and help build a bridge of hope for organ, tissue, and eye donation. Just one person can potentially save or help improve the lives of up to 75 people. By joining, your legacy could be the gift of life. Sign up today at michigan.gov/SOS or at any of the more than 145 Secretary of State self-service stations located across Michigan. Be part of Michigan's Bridge of Hope by adding your name to the Organ Donor Registry.
Welcome back to the Megacast. You're watching and listening on your radio homes, 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. And as of today, January 20th, 2022, as we're shooting this edition of the Megacast, the Michigan Department of Health and Human Services recorded on Wednesday of this week, yesterday, 4,453 adults and 114 pediatric patients hospitalized with confirmed infections in the state. About 83% of the state's inpatient hospital beds are occupied across various health systems, including Henry Ford Health System here locally in metropolitan Detroit. And joining us now to talk about the impact, the continued impact of COVID-19 on our hospital systems is Dr. Manu Malhotra from Henry Ford West Bloomfield Hospital. He is their chief medical officer. Dr. Malhotra, thank you for being with us again.
Thanks, Tyler. It's good to be back.
Appreciate having you on. So Henry Ford Health System announced their hospitalizations actually have decreased to 499 COVID-19 patients from the previous 551 new hospitalizations as of Monday this week. Does it seem like this most recent surge with Omicron is starting to take a turn back in a better direction, or are we just at kind of a stagnating point before the next hit comes along? Based on what you're finding so far and from your other colleagues across both Henry Ford Health System here locally and other health systems in Michigan and the U.S.?
Yeah, it's a good question, and I think everybody's asking that question right now. I think it's certainly appears to be that we have hit the peak. Hopefully we won't keep going up, but there's at least some evidence to suggest that we are at the peak, if not necessarily, well on our way to improvement. But I think what the numbers that you mentioned are noticeable. I'm looking at the number of patients that are in the emergency department, the number of patients that are waiting for beds to open up to be admitted to the hospital. I'm looking at a lot of the indicators of strain on the hospital systems, and there is a bit of easing on that. I don't want to break out the champagne just yet. I think, this is like kind of like, I just read a great analogy to this. This is like hitting the high water mark, but it's not until the water recedes that things actually go back to normal. And then the water certainly hasn't receded yet. The hospitals are still heavily booked with COVID patients. And, across the state and across the nation, you're seeing ripple effects of that. And those ripple effects aren't just longer wait times for acute care. It's also for surgeries being canceled and all sorts of other care being impacted as well. So that's the situation. Slight improvement. Hopefully this is a trend, but probably need to hold on and watch a little bit longer before we can say a whole lot. I've seen a lot of models around how we're expecting this to play out, widely divergent models. But from what I'm seeing, I would think that maybe by the end of January, beginning of February, we should see some significant easing of this surge at least.
And so we've heard at various points throughout the pandemic when we've had these surges in cases, when we've had a surge in hospitalizations relating to those surges or as a result of those surges or both, about the impact and the pressure in particular. That's the word we hear all over and over again, is pressure that it puts on our hospital systems. I'd like to go at this from a couple different angles. Firstly, when we have these surges in cases and we have hospital beds, inpatient beds, and bleed over into emergency room beds and so on that are filling up in our hospitals, obviously the care and attention that's going to be given to patients isn't going to change. That effort is still going to be there, but it makes the job a lot more difficult. On the COVID-19 front, for your COVID patients, when your hospital systems are so occupied, when the hospital beds are so occupied, and then you run into issues as well with staffing, when staff on the medical side and other adjacent areas in the hospital systems are affected by COVID-19, how does that affect the ability for a hospital system at an individual point or across the board to address the COVID-19 patients that are in their hospital and others in the local area that may need to be in that hospital?
Yeah, it's absolutely the crux of the issue. This makes me think of this concept that, maybe Omicron's a blessing because it's a bit less severe and it's highly infectious, and maybe it's helping us get to some herd immunity as a community widely. There may be some potential benefit there. The problem ends up being if there is no healthcare system that can be overwhelmed, if you're in some area that is so underserved that there's no other way to get vaccine or treatment, that's fine. Here, what ends up happening, even if it's less severe, the denominators become so big that the absolute number of admissions is still just as high, and it crowds out all the other care, and we actually end up having mortality and morbidity associated with routine and emergent care for other issues that we can no longer provide. So, I always want to take it back to the idea that being vaccinated, being boosted is absolutely the right thing to do. It is effective, and I'm sure that we're going to talk about that a little bit later. But as far as what does that strain look like in the hospitals, and then how do we move forward and continue to provide the care that's necessary? This is a daily calibration of our capacity. So there are on each campus incident commands set up so that we are actually looking at daily cases, the daily number of boarders in the emergency department, the daily volume of cases coming in the ED, the number of beds that are full, the number of staff that are calling off, that we are short, that may be exposed, and all those exposures are happening in the community. So that is something that each campus is doing on a daily basis. And inpatient beds are required to do inpatient surgeries. So if inpatient beds are under a ton of pressure, there's decisions made sometimes to postpone inpatient surgeries that can safely be postponed. Those cases that are emergent, urgent, time sensitive, and need to be done will be done, and we'll accommodate that in any way possible. But West Bloomfield has been fortunate that we've not had to postpone cases. We've been able to accommodate our surgical obligations to the community, but it's just by the hair of our chinny chin chin. I have to give a lot of kudos to our chief nursing officer, that's Stephanie Roberts-Newman, and the entire nursing team and the rest of our ancillary staff and physicians for going above and beyond. So many of them are working overtime to make sure that we can keep beds open. And there's across the state and across the country such a shortage that while we have patients waiting in the ED, there's not enough staff in the hospital to even staff the beds that we do have sometimes. So, we've been very lucky to be able to continue to provide those services. And it is a daily struggle to make sure that if this area is short, can somebody else come in and support that? Can we do out an emergency call and get somebody in to come in? We've relied on agency, much like every other hospital in the area. Critical pay. It's just that 2 years into it, it's difficult to keep going back to the same well. And people are just running on fumes at this point. So I really do appreciate the opportunity to say something, and thanks to the folks that are fighting the fight every day on the front lines.
Yeah, and the people have continued to do so throughout this pandemic, who have joined in on the fight on the front lines throughout the pandemic at any various point. They've been under this pressure so many times that on one hand, it's a blessing because they know what to do when we get to this situation, but it's also a continuous negative that reoccurs because we keep having to get back to this point for one reason or another. We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital, joining us on the Megacast. And of course, with the Omicron variant, as you said, it seems that the results have been, the symptoms may not have been as severe, but the contagiousness, the rate of spread of this particular variant has been a much greater challenge than we've had with Delta and that we've had with other variants previously of COVID-19. And that's partly been one of the factors that's gone into the rise in hospitalizations and some of the pressure that's ultimately amounted on our hospital systems. But throughout this pandemic, we've heard more and more about, of course, about the personal risks that we take if we are affected by COVID-19, if we're exposed, if we are COVID-19 positive, especially for those that are unvaccinated, but also for those that are in at-risk positions that may be in need of emergency care, that may have respiratory issues, that may have other underlying health issues. And those people are also hospitalized, along with those that are COVID-19 positive. And while precautions are obviously taken to ensure that patients that are coming in without a COVID-19 positive, without being COVID-19 positive or not being exposed or not going to be positive for that, their care is also heavily affected. Can we touch a little bit at least on just how much a surge like this affects the timely care and the effective care of others that are also at risk, not only because of COVID-19, but because of other ailments that they're going to the hospitals for, or that they may need treatment for severe in the moment or timely for down the road?
Yeah, no, absolutely right. And just as I was mentioning about surgery specifically, there are many hospitals that are having to cancel their elective surgeries altogether, or at least significantly postpone them. And just because something is an elective scheduled surgery doesn't mean that there isn't going to be some discomfort or downside to postponing. I mean, knee replacements are, an elective surgery, but that's actual pain and discomfort that somebody will prolong because of that. When the emergency departments are overly full, that directly increases the amount of time it takes to get care. That just creates a longer queue. And that doesn't matter in some cases, and it can matter in other cases. And, we have a very robust triage process to make sure that we're able to identify the people that can't afford to wait. But what we're looking at there is a threat to life and limb. But there are people who are in pain, and, people who are in threat of life and limb are being prioritized over them. And because everybody is stretched a little bit thinner, there are delays built into that. So I think we just have to acknowledge that and really be a bit cognizant of the fact that we should only be using emergency departments for emergencies right now. We've had some patients coming in to get tested for COVID without exposure, without symptoms, because they're getting ready to go on vacation. And it doesn't seem like that big of a deal on an individual basis, but when you start aggregating the time and manpower that it takes to handle that, it is an absolute, just absolute added stressor on an already distressed emergency department situation. So I think everybody's asking to make sure that we're really only going to the emergency department for what we think are emergencies, not for convenience. The things that can be handled in urgent care or an outpatient clinic setting should certainly be prioritized to be handled that way.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital, joining us on the Megacast. And of course, Dr. Malhotra, beginning earlier on this week, people were able to register online to receive free testing kits in all homes here in the U.S., up to 4 kits total per residential address via the federal government. And there also have been discussions on plans to send out N95 masks as well in some cases. What are your thoughts on these two actions being taken by the federal government and the potential impact that these can have on the local level specifically, but also across the board in preventing further spread of COVID-19?
Yeah, so I think, it's essential to know what your, COVID status is if you have had an exposure. So I think having easy access to tests is pretty essential. I don't know how much of a long-term impact 4 tests per family will have. I think the jury's probably still out on that, but having easy access or any access to testing is pretty meaningful. It's meaningful for people who are being responsible enough to require testing before they're gathering, if they are gathering, which, right now we certainly are not recommending large gatherings at all, or for people who have had some sort of respiratory complaint, they feel like maybe they have a cold. Well, Omicron sometimes looks like a cold right now. And instead of just sort of shrugging and figuring, I'll just make sure I wash my hands and keep my mask on, I think it'll create a little bit more safety and peace of mind to be able to test and be able to answer that question. Now, the tests aren't 100%. I think that's just something to acknowledge. But for people who have symptoms, for people who are making sure that they are following the instructions exactly, they are pretty effective. For people who are asymptomatic or people who are not doing a good job of following those instructions, yes, the sensitivity drops off significantly. But I think having knowledge of our COVID status, if we're having symptoms, is pretty essential, and it probably will stop spread. And the N95s are difficult to get in the market right now. So I think especially for the immunocompromised and elderly, people who have a lot of comorbidities, if they're in enclosed spaces, it's not a bad thing to be able to have access to N95s.
We're joined by Dr. Manu Malhotra. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital, with us on the Megacast. Dr. Malhotra, just a couple more minutes with you before we'll say goodbye at this time. Is there anything else right now that would be important for our audience to be considering in terms of how we can help our healthcare workers on the front lines, or hospital systems in particular, continue to battle COVID-19, or anything else on the COVID-19 front or on the medical front that we should be keeping aware of at this time?
No, I appreciate that. I think number one, as I mentioned a bit earlier, is to you just really be a bit more discerning about what's going to the emergency departments. That is really the biggest pain point right now, and really the highest risk area. So making sure that non-emergent complaints are taken to other venues is really something that we can do to make sure that we're keeping those emergency lanes open for the people who need them most, and those are our friends and family. The other thing that I will say is I feel like I definitely want to address this thought out there that maybe vaccination isn't as effective as Omicron. And even with the data that we're looking at in our hospitals, when you look at people who have vaccination and boosters, they have a vanishingly small number of admissions. There are people who were vaccinated who are getting admitted, but if you got boosted, those numbers go down significantly. And when you look at the people who are admitted, who were boosted and vaccinated, they're people who have very significant comorbidities, lots of medical problems, otherwise immunocompromised. Those are the people that would continue to be at risk despite those precautions. So I would, again, really reiterate how essential it is to get that added protection with vaccination if you haven't had it, and a booster, absolutely. If you have had your vaccine, it is making a huge difference in the Omicron experience. And then if you have already had COVID, the amount of added protection you get between having had the infection and the vaccination is the highest amount of protection that you could have. But people are getting COVID more than once, so don't think that you've got it once and you're done with it. Immunity starts waning after a while, and two, as these variants change, it's valuable to have both the vaccination and the innate immunity, because they both work slightly differently and provide an added amount of protection. So again, I'll just emphasize the importance of vaccination, wearing masks, hand hygiene, and really avoid large gatherings in indoor settings, at least until this surge is in a trough.
Dr. Malhotra, thank you very much for your time. Thank you for giving us more insight into how COVID-19 and this recent surge is continuing to affect our hospital systems.
Thanks for the opportunity to talk to you. Have a break.
Appreciate it. Dr. Manu Malhotra, Chief Medical Officer at Henry Ford West Bloomfield Hospital. You can learn more information about Henry Ford Health System and their locations, and find some helpful materials as well about COVID-19 and other health-related issues by visiting henryford.com. And in addition, as Dr. Malhotra talked about vaccinations and booster shots and keeping yourself protected from COVID-19 as much as possible. You can get more information locally and statewide on booster shots as well as COVID-19 vaccines by going to civiccentertv.com/coronavirus and clicking on either our State of Michigan link, which will take you to the coronavirus page for the Michigan Department of Health and Human Services, or the Oakland County page, which will take you to the Oakland County Health Division's website, where if you navigate down just slightly on that page and click on vaccine, or just go straight to oaklandcountyvaccine.com. You can learn more information about vaccines, about the booster shots, as well as where you can get them and sign up for appointments to get vaccinated or boosted as well. We're going to take a quick break. On the other side, we will go from medicine to art, and we'll be speaking with John Sov, who is a sculptor and the creator of the Man in the City project, about not only man in the city, but also his efforts using art to help the local youth in our communities as well. That's coming up next. You're watching and listening to the Megacast.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. Call 211 or visit 211.org. 211. Get connected, get help.
If you are struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to a $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311.
A public service announcement from 89.3 Lakes FM. I'm joined now by the artist behind the project Man in the City. It's sculptor John Sov is with me on the Megacast. John, thank you for being with us today.
Thanks, Tyler. Good to talk to you.
Yeah, good to talk to you as well. So let's start by talking about your art background. When were you first introduced to art, and what ultimately inspired you to become a sculptor?
Well, actually, I was always interested, and you know how there's people that are inspirational to you, and I remember at a very young age, my dad taking me to the Detroit Institute of Arts, and it kind of stuck with me. And in college, I took art history and ended up right out of college working for the Michigan Commission on Art in Public Places, which was a newly developed division that was dedicated to a 1% program. So all new buildings in the state of Michigan had to spend 1% on art, whether it's interior or exterior. We dealt with primarily public art, so it was mostly large-scale sculpture, but there was a lot of two-dimensional work involved in it as well. And that was my whole introduction to the art world from a professional standpoint. And ever since that job, I tried to figure it out. And it's not like there's an easy roadmap. It's just dedication.
We're joined by John Sov. He is a sculptor and the creator of the art project Man in the City. And so let's talk about Man in the City. What were the beginnings of this project, and how has it developed over time to grow into today's work?
Well, it all started with an opportunity at a fundraiser I attended in 2008. I was in New York, Lower Manhattan. It was a fundraiser for a group called Henrik Martin Institute. And they had some kids' work that was out on tables, and they notified me. I ended up talking to a guy around some of the artwork, and he notified me that the kids' art program was cut for that upcoming summer. And so we talked a little bit more, and I said, hey, if I could come up with a plan, would you be into it? And he said, absolutely. So right after that fundraiser, I had a couple conversations, and the Mark Echo Foundation said that they would like to support something like that. And so we had a plan. And I also was at the time working with the two guys who started the High Line in New York, which is an elevated railway line and the newest public park in the city of New York. I say newest, but it's been about 10 years that that park has been open, and it's completely changed the landscape in Hell's Kitchen and Chelsea. And this was the very first public art project, Man in the City, on the High Line.
And so, John, the Man in the City itself is it's an orange metallic sculpture that is on top of buildings throughout the city. Why the choice of the location being on top of a building in the city and not somewhere that's more visible to those that are walking about in the city from the ground level? Why choose the top of the buildings?
Tyler, didn't you see him on top of the building?
I've seen a few pictures of him on top of the building.
Oh, they stand out much better on the rooftop, trust me. And the idea is to position yourself within the city. When people are looking up, it gives them an opportunity to think differently. Just by catching it out of the corner of your eye, it makes you think about possibilities. It makes you think about your own place within the environment. It makes you think about the building itself and the history of the building. And you asked me about the locations, and when it came to installing these pieces in Detroit, it was more about my connection to those actual buildings and the architecture, whether it be because there's a nonprofit inside the building like the Scarab Club or Detroit Artist Market or the Detroit Historical Museum or the Dawson Great Lakes Museum, all these great iconic locations in which these sculptures are installed, also bring attention to those buildings. And we've utilized that over the last 10 years of the project to highlight the cultural events within the city of Detroit. And so each one has a personal relationship with me because, number one, I installed it, but number two, I have a relationship with the people in that building. So it's my way to meet new people, but also to support people that I've had a long-term relationship with and think need to be identified in another way.
And so earlier, John, you mentioned that your Man in the City work has also expanded to youth organizations across the country as well. Can you tell us a little bit about the connections between this project and your work with underserved youth and communities, not only here locally here in Michigan, but also throughout the U.S.?
So the whole concept of this project was started around youth. It was at this fundraiser that I mentioned to you that from the very inception. We've always had a connection to youth programming. It's one thing to put public art up and just walk away. It's another to feel this sense of commitment to the community in which you're installing the art. And that's just me. That's just my personal way of engaging with the community. And so I've developed this Man in the City project for kids art programming. And in the city of Detroit, we've done it. I was the artist in residence at the Bowl Family YMCA for a number of years. I worked with YouthWorks Detroit, worked Big Brothers, Big Sisters. In fact, tomorrow, I've been working with the Living Learning Center in Northville, which works with high school and older kids that, once you're out of high school, the support from the school system stops. And where do those kids go? And Living Learning Center does a great job at picking up the pieces where these kids, when they leave, they have another option, another support group that that tries to work with these kids. And I told them about the project, and for the last year, I've been working with them. And tomorrow, we're having an open house at Living Learning Center in Northville, where people can come and see the project and also learn more about a great organization in Northville, within the Detroit metro area as well. So for me, if one more person finds out about Living Learning Center as a direct result of this project, it's a win. And then the other part of it is I get a chance to communicate with people and learn new things in the process as well.
And so, John, we're joined by John Sov. He is a sculptor and creator of the art project Man in the City, joining us on the Megacast. John, you mentioned that part of what you love about your art is being able to have that interaction, and especially in your work with the youth as well, is to have that interaction with your community. And as the pandemic's gone on, we've had ebbs and flows of times when we were able to be more active and more communicative with our communities, and other times where we were needing to be shuttered away or be hands off. How has that impacted your approach to your art as well, not only for yourself as an artist and for that full sense of fulfillment that you get from producing your art, but also knowing that it takes on a different meaning, having that interactivity with your city when you're interacting with it visually versus with other people, or in addition to interacting with other people in the city as well?
Without putting too much thought into it, I would say the pandemic has only affected projects that I had scheduled, that were dedications of public artwork or group dynamic programs where there was a large group that was going to meet. Those things had to be obviously shut down. But when you shut that down, it doesn't mean I stop. I still have Zoom. I still have a phone. I still am able to make connections and make new opportunities. So my thing is, you just have to be able to bob and weave. And the good thing about what I do and how I approach my work is I'm always doing that. I'm always looking for new opportunities. And so when one door closes, another opens. And all throughout the pandemic, I was working the phone. I was, still creating, still doing other things, but I kept my communication lines open so that I knew when things did open up and shut down and open up and shut down again, I still, you just postpone or look for new things, and you got to be creative about it. So I would say it affected me in the sense of things that were scheduled, but not in the sense of things that were open to new opportunities. But I think everybody had to do the same thing. It's not just me.
We're joined by John Sov. He is a sculptor and creator of the art project Man in the City, joining us on the Megacast. And so, John, you mentioned that you have your Man in the City Mini-Man debut on Saturday, January 15th. It's tomorrow in Northville. You told us a little bit about that event. Give us more details in case people want to be able to join in on the event if they still can. Where will it be in Northville? At what time of day?
So in Northville, it's on the corner of 8 Mile and Wabash. And if you go to livinglearningcenter.com in Northville, you'll be able to find it. It's at 4 o'clock, and it's in the art department. They have the garage has been converted of this mansion. It's the Don Massey Mansion is where the Living Learning Center is located. It's 12 acres. It's an amazing place. There is just so much to learn see, and do at that location. But we're going to be just in the art department. That doesn't mean people can't tour the mansion, can't tour the farm, can't tour the petting zoo, and all the other things that are available. They're really amazing people over there, that their heart's in it. And it's a really dynamic place that's a valuable part of the community. So if anyone's interested in all, it's at 4:00 tomorrow. Go to livinglearning.com, and I'm sure you can find it.
And so, John, what other projects are you working on in the future that people may be excited to see if they want to keep up with your work?
Well, this past year, I was part of a Perrysburg sculpture exhibit in Perrysburg, Ohio, and I was selected as the artist in residence for the University of Toledo. And so we started on Monday. I'm working with the Achieve Academy in Toledo. It's a school where part of the population is actually homeless. It's a high school where part of the population is homeless. And so it's kind of a transient thing. Kids might show up for a couple weeks or a couple days and not show up again for a while. And for me, these are kids that really need what the arts have to offer. So we came together at this event last summer, and we've developed this program, and we're working with the Toledo Museum of Art to exhibit the kids' artwork. Same type of project, Man in the City. There's one located on top of the Toledo Museum of Art. The kids are modeling after that piece with their own miniature sculptures, and I'll be working with them through March to do an install and a dedication in April at the Toledo Museum of Art. And the whole idea is these kids go from concept to finished design. I'm working with a great art instructor over at Jan over at the Allegiance Academy on this project. And the transformation that can occur with these kids is amazing, especially kids at risk. They need support. They need encouragement. And a project like this, no matter how small it is in the big scheme of things, it still can make a transformative thing. When kids work from concept to finished product, that means that they can, do anything if they put their mind to it. And if it sticks with one kid in this project, that's worth it for me. If one of them walks away with, hey, I can do anything. It's kind of a lofty goal, but at the same time, I've seen it happen, and I'm willing to continue to do it because I get more out of it than anybody else.
Well, John, thank you very much for joining us, telling us more about Man in the City, as well as all the other work in cities throughout the U.S., as well as with our youth.
Tyler, I appreciate the opportunity. Thank you.
Whether you're the city,
the county,
or the Huron River Watershed Council,
we work together to protect water resources for everyone.
Most of the pollution entering our rivers is carried by rainwater that runs off roads, parking lots, and rooftops.
A rain garden helps catch stormwater runoff.
Rain gardens and their plants help dirty runoff soak into the ground.
You can do your part to help keep our water clean.
Learn about rain gardens and native plants.
So consider a rain garden in your home landscaping.
Catch the runoff with a rain garden.
There's one water, and it's ours to protect.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried if, when I did get home, that he wouldn't know who I was. Being 27 and a mom and a wife and having that all almost taken away from me. It's scary, and if a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
A message from the staff of Michigan's Crime Victim Compensation Program.
Anyone can be a victim of crime
and suffer lasting trauma, physically, emotionally, and financially.
But you are not alone.
If you're struggling financially due to a crime,
we're here
for you. Find out if you qualify for crime victim compensation.
Call 877-251-7373 or visit michigan.gov/crime-victim.
A message from the Michigan Department of Health and Human Services, Division of Victim Services.
If you are struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to a $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit or call toll-free at 833-511-0311.
A public service announcement from 89.3 Lakes FM.
You see certain things get reincarnated in your children. My daughter is very much inspired by my wife's artistic pursuits. So my daughter started making necklaces. She makes what we call affirmation fashion. I tell her every day that your black is beautiful. Your black is beautiful. Your black is beautiful. And if there's anything better than being beautiful, it's being smart. And if there's anything better than being smart, it's being kind. And reaffirming that every day is our method of making sure her chin never drops. My dad wasn't around. And I remember riding a bike and falling off and cutting myself, and me never just wanted to get back on it. People ask, how your children learn how to ride a bike, and you didn't. I didn't teach them. I just created an environment where they taught themselves, and all I had to do was be there.
Welcome back to the Megacast. I'm Tyler Keefe. To learn more about our show by visiting civiccentertv.com/megacast. We have links to every one of our partnering television, radio, and web outlets, and you can find more information on them by clicking on those links, as well as find all of our shows and each individual interview on demand. Again, civiccentertv.com/megacast. Joining us now is David Franco. He's the director of the Exceptional Academy through the Living and Learning Engagement Center, which, of course, is a Share Detroit-supported charity and nonprofit. David, thank you for being with us today.
Tyler, thank you for having me.
Appreciate having you on. So, first off, tell us a little bit about the Exceptional Academy and the services that it provides to those that are being served by the Living and Learning Engagement Center.
Yeah, so the Exceptional Academy, just to clarify one misnomer, is that it's not a place. It's actually an advanced work skills training program provided by the Living and Learning Enrichment Center to area adults with disabilities. Currently, we focus on one curriculum focused on IT certification training, with a focus in cybersecurity. We've been doing this for 3 years now, and the program is basically like a typical school year. It lasts from the fall until the summer. It's actually the first program of its kind in the state of Michigan when we started in 3 years ago, and it was only the second of its kind in the entire country at that time. There are more now, but like I said, we were only the second of its kind ever. So it's really a groundbreaking program.
Yeah, it's a great program. It's a partnership, of course, between the Living and Learning Engagement Center, also Cisco Networking Academy, Mitch Album's Say Detroit Play Center, and consulting support as well from Patrick Romzik, who was a retired Cisco executive and the program designer. Of course, and we're talking with David Franco, the director of the Exceptional Academy, on the Megacast. And as you said, this is a program that provides IT certification training for individuals that are affiliated with the Living and Learning Engagement Center. So what does this program consist of? How long does it last? And what are some of the educational experiences that go into helping these people gain this certification?
Yeah, so like I said, it lasts a typical school year. So we go from September until May, June. And it's basically a full-time program. We meet Monday through Friday, 9 a.m. to 4 p.m. And the way our day is structured is, from 9 a.m. to noon, we have, typical just typical teaching. But we modify our approach. We use multiple formats. Our teacher won't just talk for the full 3 hours. He'll kind of mix it up. He'll do some live instruction, and he'll mix it up with like video, classroom discussion on the topic. He'll introduce lab work, but it's all modified to accommodate people with disabilities. And while we work with people with all disabilities, the most popular disability for our students is autism. And just to kind of put this in perspective, this curriculum is available all over the world. I mean, there's the Cisco networking academies are everywhere. This is one of the only ones, though, that's geared specifically towards people with disabilities. And to like I said, to put it in perspective, if you were to take this curriculum at a local college or university, they'll meet with their students about 4 to 6 hours a week. We meet with our students 30 hours a week. And what makes this successful is the fact that, like I said, in the mornings we do the typical instruction, and then the afternoons we reserve that for guided self-study. And so the students will study the material on their own, but the TA, there's a TA and the instructor that are available to answer any questions that they have. And in the afternoons, we also focus on one-on-one instruction and small group instruction. And so that's where we really drive the material home. That's where all the material is actually customized, because all of our students learn in different ways. That's what the autism spectrum is all about. And so our instructor has to be able to identify the different learning styles that each student is comfortable with, and that's how he works with them in the afternoons. And so that's what makes this a success, is that the customized approach, the fact that it's adapted in terms of being lengthened, and just spending more time on the material so that we can make sure that all the students are successful. I'd like to mention the fact that while the primary goal of the Academy is to provide this technology training to area adults with disabilities, the secondary goal is to raise awareness with area employers and help them become more disability friendly and able to and really understand the benefits of working with people with disabilities. And so we work with them by getting them as intimately involved with the program as possible. We have like guest speakers from various corporations. We'll have like site visits. Either they'll come to our classroom, or we'll go to their facility to see like their IT department and talk with their IT staff and learn about what it's like to work in technology, networking, and cybersecurity. So we do is whatever we can to get them involved and really engage with the students so that they can understand what they're capable of. So in that regard, it's very, very helpful, because we're helping all these companies really get a better understanding of working with people with disabilities.
Yeah, and also, and these programs like this are also providing great opportunities for individuals with disabilities, and as you said, in particular, those with autism, to find long-standing careers that are in areas of their interest and areas of passion for them, that they're able to learn these skills and learn these proper techniques, build them into careers, and have a lot of success. Can you give us an example of a success story, or a couple of success stories from this effort, from the Exceptional Academy?
Yeah, most definitely. So, and before I get into the stories, the one thing to understand is that all of our students that come through the program, they either have never worked a day in their lives, or if they have worked, they've worked part-time jobs making at or near minimum wage. And so that's what we're starting with. And so, just to give you an example, in our first year, like I said, we're in our third year now, but in our first year, we had a student who was working as a janitor at Del Taco. And, this is the type of job he probably would have had for the rest of his life. He came to the program, did very well, got his certification. We got him an internship with one of our partners, Plant Moran, and he was in that, and that was at the time of COVID. So unfortunately, that internship was supposed to be obviously in person, but because of COVID, it had to be done remotely. And so what happened was, it was supposed to be a 3-month internship, but because they couldn't devote as much time to it as they'd like, because it wasn't in person, they kept extending it. So 3 months became 6 months, 6 months became 9 months. So it was a really, a pretty long internship. And then after the internship was done, they brought him on, and he is now a full-time cybersecurity consultant for Plant Moran, one of the largest accounting firms in the country. And so, and actually just this fall, he became a published writer as well, because on Plant Moran's behalf, he published an article on corporate cybersecurity. So, the list of this gentleman's accomplishments just continues to grow. And so, it really changed his life. And just another example that I wanted to provide was we were working with somebody. It was a former vet, a disabled veteran. She had a physical disability, and it was really strange. I've heard her story many times because she's talked about it publicly. And this was somebody who, spent many years in the Army. She had a college degree, single mom, and she had multiple certifications. She didn't have our certification, but she had some lower level certifications. But for whatever reason, she was not able to get a job. And, she tried all these different avenues to get a job, and it just wasn't working. And she heard about the academy, came through just like the other person. She got her certification. We got her an internship at Comerica Bank, one of our other partners. And same type of thing. They kept extending the internship because they wanted to give her the proper experience. And once the internship was done, she was hired on full time, and she is now a network engineer for Comerica. And it's interesting because just this past Veterans Day, she was featured on the local television news as a success story for a disabled veteran. So just these are the types of things that are happening. It's this program is absolutely changing lives for the better. So really exciting stuff, and it's happening right here in Detroit.
And so, David, if people are interested in this program, either individuals or families are interested on behalf of a loved one, how can they get more information and maybe even sign up to be taking part in the Exceptional Academy? They could either contact the Living and Learning Enrichment Center, and if you go to livingandlearningcenter.org, they can look up our phone number and they can call and express interest there. We have a Facebook page that's it's Exceptional Academy Northville, and there's ways for them to reach us there. Obviously, the Share Detroit website has our contact information. So there are multiple ways to reach us, and getting involved with the program just requires an intake. An intake is basically like a 20-30 minute call with me, just so I can get some background information and make sure that the student is qualified. We look for 10th grade reading and math, and of course a strong interest, if not a passion, for technology. We're joined by David Franco, the director of the Exceptional Academy, joining us on the Megacast. You can learn more information by visiting livingandlearningcenter.org/IT-academy. Again, livingandlearningcenter.org/IT-academy. And David, there are other ways that individuals, if they're not taking part in the program or they want to advocate for the program, there are other ways that they can provide support as well for Exceptional Academy.
Oh yeah, definitely. Like for example, we have a mentorship program that we do. So we look for professionals in networking or cybersecurity who'd be willing to, talk with the students. It's basically dedicating about an hour per month just in the way of like having a conversation with a student, either over the phone or over something like Zoom, any kind of video conference. But this could be done virtually. Like I said, just an hour a month could change somebody's life. But we look for things like that. We look for professionals in the industry that can maybe do some guest speaking, anything, on any kind of topic in networking or cybersecurity is helpful. Any kind of like demonstration, a cybersecurity or networking demonstration, an opportunity to see somebody's, a company's IT environment where we can, see their equipment and talk to the professionals and get an idea of what's involved in their day. These students are learning a concept that is somewhat abstract, and then if they're able to see it in a live environment, it starts to make more sense. So, visual learners, it's helpful for them to see it live. So yeah, there's all kinds of ways that people can help.
Well, David, we appreciate your time. Thank you for joining us and telling us all about Exceptional Academy.
Oh, thank you, Tyler. I appreciate it.
You're welcome. David Franco, director of Exceptional Academy, which is affiliated, of course, with the Living and Learning Enrichment Center. You can learn more information about the Living and Learning Enrichment Center by visiting livingandlearningcenter.org, and learn more about Exceptional Academy by visiting livingandlearningcenter.org/IT-academy, or just scroll over on their website. There at the top of their page, there is an IT Academy link that will then bring you to the certification program and the cybersecurity certification program that David and I spoke about today. That is going to do it for today's edition of the Megacast. I want to again thank all of our guests on today's edition of the show. Of course, David Franco, the director of the Exceptional Academy in partnership with the Living and Learning Enrichment Center, for joining us. John Sauv, an artist behind the Man in the City project. Dr. Manu Malhotra from Henry Ford West Bloomfield Hospital, their chief medical officer. Roz Keith, the founder of Stand With Trans, and of course our first guest on today's edition of the show, Leo Nouhan, one of the board directors and conference coordinator of Kevin's Song, and of course talking about their 6th annual conference on suicide prevention that will be coming up in just actually next week, January 27th through the 29th. If you missed any of our interviews from today's edition of the show, or you're just tuning in to our full episode, you can find us on demand usually by mid to late afternoon at civiccentertv.com/megacast, where we also have links to our partnering television, radio, and other media outlets, so you can view us live wherever you're at on the road and all throughout Oakland County and the state of Michigan, or on demand as well. Highly encourage you also to go to our coronavirus page at civiccentertv.com/coronavirus to continue to learn more information about COVID-19 from the Centers for Disease Control and Prevention, the Michigan Department of Health and Human Services, and the Oakland County Health Division, as well as find more information on all of our top stories making headlines across the state of Michigan each and every day that we post before our live shows. Big thank you to our entire crew, our technical producer, Calvin Brown, with me here in our studios in West Bloomfield Township each and every day, Monday through Friday from 10 a.m. to 12 noon for our live shows. Jared Clark at the offices of My Michigan TV in Troy, Michigan, our Zoom producer. Of course, the king of television himself, Larry Nyland, our producer, booking all of our guests, scheduling each of the shows, getting both us and the guests ready, and Maddie Muschin out at Master Control. Steve Lato Live is next on My Mind. We'll be back tomorrow at 10 a.m. Keeping Greater West Bloomfield connected during the coronavirus pandemic. 89.3 WBLD, Orchard Lake, West Bloomfield. Keagle Harbor, Sylvan Lake. 89.3 Lakes FM.
Preacher's son, and when his daddy would visit, he'd come along. When they gathered around and started talking, that's when Billy would take me walking. Out through the backyard we go walking. Then he looked into my eyes. Lord knows to my surprise, the only one who could ever reach me was the son of a preacher man.